Hello, I'm Karen Feinstein from the Jewish Healthcare Foundation, and I'm here with Audrey Russo from the Pittsburgh Technology Council. We're here to share the learnings from a Safety Innovation Summit that we jointly sponsored this year. I formed the Pittsburgh Regional Health Initiative 27 years ago with Paul O'Neill from Alcoa, who was known as the Safety CEO, because under his leadership, Alcoa became the safest corporation in the world. He believed that to earn the trust of your employees, your customers, your board, a CEO had to commit to the outer limits of safety, that it was the very platform for a good organization. So the idea that he brought to our regional multi-stakeholder collaborative that we formed together called the Pittsburgh Regional Health Initiative was that we would get our region to commit to the outer limits of safety. We would become the safest region in the country. Now this is very important because estimates say we have in healthcare anywhere from 200,000 to 400,000 preventable deaths every year from medical error. And that's a pretty significant number. The sad thing is the initiative has continued for all of 27 years, but not only have we not achieved the distinction of being the safest region in the country has declined in terms of safety, and we now have more preventable harm than we have had before we ever started our initiative. So I wanted to discover, what do other industries do? Because while our curve of safety is going down, other industries that are complex, that are high risk, they're getting safer and safer. Not only that, Pittsburgh is home to many of the companies that have helped make these complex, high-risk industries like coal mining, construction, aviation, autonomous vehicle travel. We're the home to the companies that have made these industries safe. So my goal was to learn from other industries. What are they doing that we're not doing in healthcare? How do we get safer? So I did not know how to assemble the experts. I didn't even know who they were from all these different industries. I turned to my friend Audrey Russo and said, help, can we put together a Safety Innovation Summit where we will have hearing after hearing from experts from different industries? And Audrey, take it away.
I'm pretty thrilled about the opportunity that we had. First of all, it came from this idea that I'm not sure if Karen really conveyed, is all this innovation in tech, all this innovation that's right here across southwestern Pennsylvania, and particularly inside Pittsburgh. We're working on technologies that are changing the world. And it's across every market sector, and it's across every aspect of technology and innovation. Karen says to me, why is it that these people are trying to solve problems in transportation, in anything for application development, in machine learning, in artificial intelligence? Why not the focus on healthcare? Sure, there's great companies like we heard from teletracking and people at the University of Pitt and Carnegie Mellon that are doing an intense amount of research. But why not focus on autonomy, for example, in healthcare? And it finally hit me like, she's right. We really do need to break down these walls, and they're not that hard to break down. So with the relationships that we've been able to cultivate over 4 decades at the Tech Council, we said, you know what, let's take this task, let's take this matter into our own hands and partner with her and try to chip away at these silos and facilitate some conversations where people can understand what the opportunities are. This summit really was like a first move. We were both risking, is this gonna work? Are we gonna have natural conversations? Are there gonna be synergies? And that happened. I mean, the cross-pollination that occurred as a result of every panel, of every discussion, throughout the day really occurred. And I think we're onto something. I would like to plant the flag in terms of safety. I would like that to be a legacy to Paul O'Neill and the work that you've started, 27 years ago. And it doesn't seem foreign to me that the interplay in terms of technology, the work we do at the Technology Council, is just a natural fit. It's not strange bedfellows.
Pittsburgh is a region that's unique in this regard. We have a long, storied history of advancing safety in high-risk industries and environments, such as mining, manufacturing, construction, the military, autonomous vehicles, aviation, and space travel. We even have some claim to global leadership in safety. One industry for which we are rich in resources remains disturbingly unsafe: healthcare. Accordingly, the Pittsburgh Technology Council and the Pittsburgh Regional Health Initiative arranged a summit with a series of panels representing different industries to understand what makes an industry safe. The Safety Innovation Summit, held on February 29, 2024, assembled the Pittsburgh region's renowned entrepreneurs, academic and research leaders, and those from government and the private sector to understand the key components of building safer organizations. Throughout the day, 7 core themes for safer organizations emerged. Theme 1, top leadership must commit to a culture of safety. 2, safety information systems should provide data for improvement, data that are precise, complete, timely, and comprehensive. 3, ongoing research and experimentation must be interdisciplinary. Theme 4, new technologies should be applied as they are discovered. 5, regulation can create a rapid adoption of best practices and adherence to standards. Theme 6, commercialization is needed to drive the development of solutions. And finally, Theme 7, safety training, engagement, and education should be continuous at the front line. Here are some insights from our panelists, beginning with Theme 1, commitment from the top. First and foremost, this is a core requirement for building safe organizations. The commitment to safety transcends competitive boundaries. In industries with the safest track records, competitors typically work together with the perspective that safety is for everyone.
You have to have the right executive management structure in place, and those folks have to feel the weight of safety. If safety is only my responsibility or my team's responsibility, I've failed miserably as a chief safety officer. It actually is a responsibility of every employee within Aurora. I see Matt over there. I know Matt feels his responsibility on safety a lot. And so that's how it's a system, right? It's an organizational system. So everybody has to feel that I own a piece of the safety narrative and making sure that, my fellow colleagues are safe, or I'm speaking up if I see something. And all these things have to be curated and nurtured. You're never done. But those two things have to go hand in hand. So it's yes, on the AV side, you put all the metrics in, you're monitoring it, you have the right escalation triggers when something goes above a threshold and all these kind of things. But you also need the management team and the employees to kind of, I don't want to say be bought in, but understand that what their role is and all of that for it to actually work. Because otherwise it actually doesn't work all that well.
Starting in rail was really interesting that you didn't walk into a meeting, no matter where you were, where you didn't start with a safety briefing, whether you're on track, in the office, anywhere. And I thought, wow, there's really a rigor around safety. Then I walked into a supplier's facility that was in aerospace. And before I walked in the door, there was a mirror. And I looked in the mirror and it said, safety leader, and you saw yourself. And then you walked past that, and every safety statistic was posted for that facility on the wall in front of you. They celebrated the data. They had the most recent near misses, and there were stickers for everyone's hard hat regarding any time they found a near miss or kept another employee safe. It was celebrated. It was well regarded, and those challenges, the problems that they faced with were talked about and discussed in every level of the organization in every meeting. And that's really how you improve safety. It's sharing the data, understanding each other's role in keeping people safe, and looking out for each other. And in rail, we hire a lot of people from the services and military because of that same philosophy. And it's really important, whether you're in track or in the shop environment or anywhere, to bring that philosophy to work every day.
Now show me an unsafe side, and I'll show you an unproductive side. And by definition, if you're having a lot of incidents, a lot of accidents, a lot of mishaps, you're not producing anything useful.
Things that we've done as a company in my past is that we empowered all of our employees themselves to recognize and speak up about anything. They don't suffer any consequences for stopping anything that they're doing because they find a problem.
Theme 2 was data must be leveraged for improvement. The essentiality of complete and accurate data was seen as fundamental to progress on safety. The transparency of near misses and adverse events requires protection, even rewards, for workers who speak up and reveal unsafe situations.
Data that can play a really important role where it like using artificial intelligence to mine the data that is without bias, right, can shine a light where it's been dark. And so I think that transparency is really, really critical. Because that will hold people accountable.
We have really, I think, innovated in the arena of capturing and sharing where there's knowledge gaps, crowdsourcing knowledge from employees. When you have an interactive visual process guiding you through a process, you experience something, you can update that process in process, the system learns.
All of this data that can be collected, one of the value-added propositions also is we're always looking at what is the return on investment for, not just for us, but for our customers buying our equipment. If they can take all of the information they're gathering off of the grid, download it through data analytics wheel system in analyzing that data to determine what are your pain points, what are areas that are possibly areas of higher risk than other areas.
The thing that I found that I thought that they can take from us is the way that we track injuries and the way that we track fatalities and those kind of things. It appears to me that on the healthcare space, that's not done nearly as closely as the way we do it. If we have if the industry, any of the mining industries, or I think even in the OSHA space, if you have a injury at work and that person goes home and passes away, unfortunately, 6 months later, that's an industry fatality.
3, research and experimentation must be ongoing. Safety is a science. Essential to continuous progress on safety is the trust that comes from rigorous experimentation and evaluation. New analytic technologies have helped everyone learn more from what works and what doesn't.
Most of the time, work is done safely, and we have positive outcomes. Workers adapt and they do different things to manage the process, but 99% of the time, everything goes well. And we learn more from normal work than we learn from abnormal work.
So when you look at Wabtec's founding in air brake and then moving on to positive train control, what's next is the automatic lifting and setting trains with 0 to 0. Today, we actively work with FRA and CSX to submit the safety cases in line with the expectations of the industry such that it can be safely done to actually autonomously control a train. Our main focus is not automation, but improving upon safety with some of those efforts. When you look at our kinetics inspection technology, we use machine vision from the wayside to inspect rail cars as they pass by. And we continue to expand on the number of algorithms that exist within that inspection technology. Everything starts with the risk assessment, whether it means healthcare or rail or any other transportation mode. And so when you have enough data to fully put that risk assessment forward in a manner that you understand the risks associated with what you're doing, and you have clear data and you can share that data and provide the transparency, then you can create that level of trust that's necessary to move to the next step of innovation, whether it's healthcare or any other space.
Theme 4, applying new technologies carefully but rapidly. Technology has advanced early anticipation of harm and then immediate remediation and prevention, overcoming the fears of autonomous technology and backlash from some towards AI. Many industries are continuously adopting and leveraging the strengths of new tech to make improvements in safety. New tech covers a lot of ground, from wearables, AI, sensors, advanced analytics and software to biomarkers, 3D modeling, and self-learning tools and decision support.
Biggest innovations in our industry, construction overall, but specifically in the electrical industry, would be the advent of building information modeling. What that does for us is it gets rid of a flat blueprint. It gives us a 3D model, and it allows us to go on ahead and build things off-site. We still have our trades persons build that off-site, and then they palletize it, they ship it to the site, and we go on ahead and we install it. All of our members do all of that work, but I eliminate a lot of the hazards on the job site.
We do industrial inspections, and then the results of those inspections our companies use to make predictive and preventative models.
We're in gas detection. We have developed devices that will detect a plethora, a wide range of agents. However, these individuals, they're wearable, they're portable, they're remote, but they're all connected to the grid, to the cloud, for example. They're connected to central command.
It is quite a technology. The exoskeleton technology that is coming out there is tremendously amazing. Our industry is very hard on our bodies.
And so there's a disconnect there. And so my role is to be that Sherpa, to be that connector, to solve the real world problem that is identified by the community that is then adapting that technology. So, we talk about things like artificial intelligence and AV and ChatGPT. Like I said earlier, there's a lot of fear. There's a lot of fear of the unknown. We call it techlash, right? And we see that time and time again. I've been in so many projects where if the time was not done up front to engage with a community, with business leaders, with business owners, to the people who will have the technology thrust upon them, there's upfront fear and resentment, and things get shut down.
I think the gold standard we have in our company is it better than what we do today? And sure, it can make mistakes, but so do people today make. And so is it any better than what we're doing today? And if it is, let's try and get. Let's not hold this ultimate gold standard of can it kill people? Unfortunately, it can, and I'll do everything in my power to stop it. But that cannot paralyze us. We still need to innovate. Who was it? I think one of the other panelists said we are at the slide rule stage. And we need to move, because every time we're using a slide rule and not a calculator, to borrow an analogy, we're letting someone die. So as long as we can get better than what we're doing today, I think it's valuable.
The thing I would say most importantly is it's really about managing the risk of any new technology, right? And identifying those risks and being able to articulate what they are and how to mitigate them. And less about, to Karen's point, like, oh, fear factor, I don't want anything to do with that because I heard what ChatGPT does or something like that. Mm-hmm. And I think it's really important that we kind of go into this thinking that way, because if not, all technology has some risk, and we're never going to be able to predict all the things that it can be used for, because it waits for nobody. Technology just does its thing, and it really depends on how the market adapts it and all these other kind of factors that are really hard to understand. But I would just say it starts with the fundamental premise of it's a system of machines and a system of people. If the system isn't giving us the right answer, then let's figure out what we want to tweak in the system. And that's the way I would sort of end it there.
Theme 5, regulation can raise all boats. Healthcare leaders regard regulation as anathema, but not in other industries where it's seen as essential to fair competition and to set a bar, a standard, below which no organization should fall.
Even today, you go to any of these big manufacturers, what price are you going to put on a human's life that he won't come back and see his child graduate from school? What price are you going to put? The regulation really sets the floor. It's the minimum that we can acceptably do. The reality is a lot of companies, thankfully, and a lot of that gain we've seen, the 60% gain, has been due to stuff beyond regulation as well. Regulation is very important, make sure all the boats are up. But a lot of our companies, the ceiling's a lot higher than. And the question is, why is that high? Well, many reasons. You have the Paul O'Neill effect, and that's one man. Unfortunately or fortunately, one man or one woman can make a huge difference in today's world, for good or bad, as we've noticed in the news recently. But certainly the Paul O'Neill effect exists.
The government organizations that also have influence are organizations such as the National Institute for Occupational Safety and Health, the National Fire Protection Agency, the American National Standards Institutes, Factory Mutual. And the reason I know this, every piece of equipment that all of you utilize, a safety piece, unless it's counterfeit from another country, has to be one of these government agencies receive those certifications. That's OSHA mandate right there. So it has to be. That's impacted us because the good news is we actually like standards because it assures the highest level of protection. And actually how standards benefit you. Product standards are, they don't reduce the rigor. They ever increasingly increase the rigor.
Theme 6, commercialization can drive safety innovation. Safety is advanced when safety products and services offer entrepreneurial opportunities. This feeds and stimulates research and innovation. The Pennsylvania Department of Community and Economic Development, who attended the summit, recognized this and created an innovation fund and a new Pennsylvania Regional Economic Competitiveness Challenge. Note that commercialization represents a continuing challenge in healthcare, where the market for safety equipment and services is perceived as weak.
So, a couple considerations for us here. One, from a market business perspective, first of all, is a device within the organization's mission and strategy. If it's in safety products, it certainly isn't with ours. Two, from a business standpoint, everybody certainly wants something, but what's the scope, size, sustainability of the market? So again, the size, and is it sustainable, the market, from our standpoint? And then again, is it driven by a government mandate? Then you have to make a business case. Things I throw out, the NPVs that I have to deal with, the SWOT analysis, Porter's 5 forces, all the stuff we learned in business. And then certainly the status of the technology. Someone's asking you, is there technology within reach and the availability of resources to develop that robust product? In addition, for you inspired innovators out there, again, is the device manufacturer needs to be fully aware. We were talking about rigorous certification standards, detailed understanding of user needs, preferences, have a robust product development process.
Theme 7 was frontline education, engagement, and coaching is the heartbeat of safety. As one union worker put it, quote, "Safety is 100% of what we do every day," unquote. Clearly, all the unions present believe that an investment in safety education is a large part of their mission, and the safest industries buy into that as well. They emphasize worker engagement in the design and deployment of safety equipment and processes.
We teach fundamental skills. We do everything from first aid CPR to concrete work to rod tying to scaffold building to mason tending to the environmental end to the pipeline end. So we give them the basic knowledge that they need to go out there in the field and work safely every day. Not only for the contractors, which is very, very important, but also for the member to be able to go home every night with all 10 fingers and all 10 toes the same way they came to that job site.
And this is the challenge with today's virtual environment, is that the people that actually come up the learning curve the fastest are the ones that are working side by side with the teams and being able to ask the dumb questions. They're not dumb. It's really important to understand why something is done the way it is, and learn from the history and the processes to develop in the manner that's necessary to deliver safe application.
We orally talk, we visually talk, we use speech, we use vision, and we tell them what the problem is. So rather than escalating it to some supervisor, we talk to the worker in the field what the problem is. Because they're best equipped and the quickest equipped to save themselves, save their brother who's working next door.
Healthcare has many innovators. How do we continue to spread and increase innovation? The healthcare panel embodied the depth of talent and the sophistication of the research that's going on in our region related to safety and better health outcomes, much of it inspired by military investment. However, funding and overall support for this important work must be vastly aided if healthcare systems were to commit to the 7 themes for safe systems.
But just by way of introduction, I'm Ron Corpenich. I'll be the moderator. We take an oath as physicians, primum non nocere, the Hippocratic Oath first, do no harm. Just by background, in 1999, the Institute of Medicine stood up, how do we make American healthcare safer? There was the To Err is Human in 1999 report that came out of the Institute of Medicine, followed by the Crossing the Quality Chasm. This was generated by the estimate that 98,000 people died in a year due to medical misadventures. Back then, 13.5% of our GDP was for healthcare. $1 trillion a year. This is a big cost to society. We're all taxpayers. In 2022, it's now 17% of our GDP at a cost of $4.5 trillion. In 20 years, it's gone up 4.5-fold, costing on average $13,500 per patient. How do we do it better? How do we improve preventive care, safe care, coordinated care, and patient engagement? I'm going to, with that brief opening, turn it over to our guest from DARPA, Dr. Jean-Paul Chrétien. Jean-Paul from DARPA, who's a Navy physician, is a friend of ours, and we're very grateful for Jean-Paul taking time to give us his perspective from DARPA out of the Biological Technologies Office.
Thank you, Ron. It's a pleasure to join this session and be part of this meeting, and an honor. So DARPA is the Defense Advanced Research Projects Agency, part of the Department of Defense, and it was established in 1958. It was in part a response to the launch of Sputnik by the Soviet Union. And that came as a surprise. Didn't realize that their technology was so advanced. And so part of the reason behind DARPA was to create technological surprise and to be developing technologies that are beyond what others, and especially our competitors, are working on, and to not ourselves be surprised by technology in the national security space. And so DARPA's mission then is pretty much the same as it is now, and that's to make pivotal investments in breakthrough technologies for national security. And so we look at the types of scenarios that the Department of Defense is planning for, and we see some real challenges there from a medical perspective. And so we're thinking about situations where service members may not be rapidly evacuated to an advanced medical facility if they're injured. So in much of the time in Iraq and Afghanistan, we had this concept of the golden hour, policy of the golden hour, and that really drove medical planning. So so service members and like colleagues on the panel here, like Dr. Spinella and Dr. Portpadich know this very well, how critical this was to saving lives, that injured service member can get to surgery within an hour. But what if we can't do that because we don't have the ability to transport people as freely? And same sort of challenge with supply chain. What if we can't get the medical supplies in that we want for a unit? Or what if we have to deal with larger numbers of casualties at a time than we're accustomed to dealing with? So some real challenges there that we're trying to develop technological solutions for. And we've always been interested also in recovery of service members. So after people have been injured, how do we get them back to duty? How do we restore quality of life? And so in the office now, we're interested in artificial intelligence applications to decision support and to automated medical care systems. So medical providers might be able to care for a large number of patients at a time, and we might be able to elevate the capability of medical providers and give them the ability to make decisions and assessments and do things that maybe in the past they weren't prepared to do. We are looking at biological treatments that will stabilize the patient's physiology and extend that after they've been injured, and so turn that golden hour into multiple hours or even days. We're interested in modeling and simulation that will help us predict the effect of interventions, so we can more quickly get to treatments and other solutions that will work when they get into humans. Extended reality for training and for real-time decision support, and lots of other things too to try to address those challenges. And so I'll briefly highlight a few examples of really excellent DARPA biomedical work happening in Pittsburgh. By no means comprehensive. These are just from my portfolio, but I think gives you a good idea of the cutting edge research that is happening. So first example is developing a whole blood substitute or whole blood analog. We transfuse donated blood to people who are experiencing severe bleeding, and it is life-saving. But we have challenges getting blood to some units because we need a cold chain, and we need to change it over every month or so, and we're entirely dependent on donations. And so this could be a real challenge. It's a challenge now, to be a bigger challenge in the future. So we have a program that's developing a biosynthetic analog to whole blood that will be hopefully just as good as real blood, but it doesn't need to be kept cold, and that we can manufacture at scale. And Dr. Spinella is leading a group at the University of Pittsburgh that has a key role in that effort. And part of what they're doing is benchmarking and doing a deep investigation into the state of the art now, the donated blood we use, which is our reference standard, and finding out some really, really important things there. So playing a foundational role in this cutting edge research that is a very large consortium coming together to work on this problem. Second example, also University of Pittsburgh, is a new effort called the DARPA Triage Challenge, where we're developing scalable and predictive approaches to medical triage and mass casualty situations. So this is quickly identifying people who need care most urgently and getting them the care they need. And that's a real challenge when you've got an overwhelming number of casualties. So as part of that effort, Dr. Gayet is leading a team that is capturing detailed clinical data from thousands of trauma patients early in the post-injury period. So on the helicopters, they're being transported to the hospital. This is the data we need to develop decision support and predictive algorithms, so we can predict ahead of time who's going to need major interventions, who's going to, for example, need a lot of blood. Can we figure that out before that need is obvious? And this data set is going to be an absolutely unique resource that we hope is going to enable tools to develop those artificial intelligence-based algorithms. We have another group working in the DARPA Triage Challenge in a very different way across town at CMU. Dr. Ellenberg is leading a team that is developing autonomous robotics systems. So robots and drones with various types of sensors on them. And the idea is that they would be able to go out into a mass casualty situation. Say you have an earthquake with thousands and thousands of victims all at once, not many humans on the scene yet. You could deploy a system like this that would quickly identify people and assess their injuries and relay that information back to the responders, so they know there are some critically injured people in these locations, so you need to get there first. And these systems are going to work entirely autonomously. So some really interesting research that's going to be coming out of that effort. A few quick examples of research that I'm super excited about to give you a feel for this sort of work. And I think these efforts are going to lead to better and safer medical practices for trauma patients and for veterans and others recovering from serious injuries. And from my perspective, and this is the last thing I'll share, I think these efforts and other cutting edge research efforts like these are laying foundation for a more comprehensive and a more ambitious research agenda for safety. And I think that's critically important because innovation and safety go hand in hand, and we're going to need platforms and knowledge for testing the safety of the exciting developments that we're seeing in these programs and others.
I think it was Drucker. He said healthcare is the most complicated business on the planet, and it's true. Health systems are, and I think most people that have experienced and worked in this industry understand health systems are systems largely in name only. It is multidisciplinary, but there are so many handoffs there. It still takes 25 people to say yes and one person to say no to derail anything that crosses those boundaries and those borders. So it's an incredibly difficult environment. Technology advancement and movement in healthcare was 75 years from the time the stethoscope was invented before it hung around doctors' necks on a regular basis. It's taken a while. They were the first to adopt pagers, though, very, very quickly. And so we do see things moving past that. I think that there is a trust problem around AI in particular.
It was really clear that within the course of a day, that we generated new collaborations. Within the course of a day, I think it exceeded anything that you and I even thought was possible. So the collaborations that occurred were across big companies, small companies, university, practitioners in the field of healthcare. I mean, the panel that we had with physicians was just really powerful, and I think it facilitated a lot of the people in the audience going, whoa, it's not a silo. There really are opportunities for collaboration, and that was very evident. And then what's happened since then is just people are saying, yeah, we need another summit, but how do we facilitate this so that it can live even on a more frequent basis, not just on an annual basis? And how do we continue to nurture that? And I think that's the opportunity, Karen, that we need to work on.
So thank you, Audrey. We could have never done this without the Pittsburgh Technology Council and you and your team. Also, I guess we need to thank the panelists who gave us so many insights that we had a terrible time editing this down into a short series of clips. And the good and bad news is our evaluations from the summit suggest that everyone wants us to do another one. So there will be a follow-up, and we're not done working together. Thank you.